Hi guys, welcome again to my YouTube channel. Um, Please tune in, subscribe to my YouTube channel. Like and share this channel so that I'll be able to bring more videos. Today I'm going to talk about the structure of the heart and associated conditions. Um, this is just a rough diagram which shows a cross section of the heart, and we are going to discuss about the structure of the heart and its associated conditions. So from the outside of the heart, the outer the outer layer of the heart is called the pericardium. The heart consists of three layers, and of these three layers, I said the heart consists of three layers of tissue. So for these layers, from outside to inside, the outer layer, this one, is called the pericardium. The middle layer, which makes about 95% of the heart tissue, is called the myocardium. And the inner layer, which lines the heart, is called the endocardium. So I'm going to start talking about the outer layer, which is called the pericardium. The pericardium is the outer layer of the heart. This pericardium confines the heart to its position, which is the mediastinum. This pericardium also protects the heart, while it also allows it to freedom of movement during its vigorous and rapid contractions. This pericardium itself has got two main parts. The outer part of the pericardium is called the fibrous pericardium, and the inner part of the pericardium is called the serous pericardium. So the fibrous pericardium is the one I want to talk about first. The fibrous pericardium is composed of inelastic, dense, and irregular connective tissue. This fibrous pericardium fits like a bag on the, and it rests on the diaphragm. Its connective tissue fuses with the connective tissue of great vessels that enters and leave the heart. Its fibrous nature prevents over distension of the heart as it contracts vigorously. It also protects the heart and anchors it in its position in the mediastinum. The inner part is called the serous pericardium, the inner part of the pericardium. So the serous pericardium also is a thin membrane which is double walled, and it surrounds the whole heart. This serous pericardium, like I said, has got double layers. The inner layer is called the visceral pericardium, and the outer layer is called the parietal pericardium. The parietal pericardium is fused to the fibrous pericardium, and the inner part of the serous pericardium, which is called the visceral pericardium, encloses and is attached to the myocardium. In between the visceral pericardium and the parietal pericardium is a thin film of fluid. It's a thin film of lubricating serous fluid. This fluid is secreted by pericardial cells and is called pericardial fluid. The space between the visceral pericardium and the parietal pericardium is called the pericardial cavity. So this is the anatomy of the pericardium, and the conditions that normally affects the pericardium is called pericarditis. Pericarditis is the inflammation of the pericardium. This inflammation of the pericardium can either be acute or chronic. Acute pericarditis can occur suddenly. It's of sudden onset, and it's usually its cause is unknown, but it can be related to viral infection. Acute pericarditis can cause chest pain due to irritation of the pericardium. Chest pain, and this chest pain can be associated with shoulder pain and arm pain, and can be mistaken for heart attack. This acute pericardium can usually it lasts for a week and is treated using medications that controls inflammation and pain. For example, ibuprofen and aspirin. Then for chronic endocarditis, onset is gradual and it's usually long lasting. Chronic pericarditis can be due to accumulation of fluid in the pericardial cavity. That is the accumulation of pericardial fluid, and this can be fatal if the accumulation of fluid is massive. If there is massive accumulation of fluid, it can be fatal because it can cause compression of the heart, and when the heart is compressed, there's going to be reduced ventricular filling. When there is reduced ventricular filling, we are going to have decreased cardiac output, and when there is decreased cardiac output, there's going to be also decreased venous return to the heart. We are going to have low blood pressure, and also breathing is going to be difficult, and this condition is called cardiac tamponade. Cardiac tamponade is a medical emergency, which means that the more we delay, the more the condition becomes fatal. It should be treated urgently. The main treatment for cardiac tamponade is pericardiocentesis. Pericardioscentesis is whereby a needle is guided through fluoroscope through the chest wall, guided by the fluoroscope into the pericardial sac, and there's going to be aspiration of or drainage of the fluid from the pleural cavity, so that the compression of the heart is eased. Otherwise, if treatment is not done urgently, we are bound to lose the patient. So that's the most common conditions that are associated with the pericardium. It's pericarditis, and this pericarditis, like I said, can either chronic or acute, and it's usually inflammation. Pericarditis is inflammation of the pericardium, and the most common cause is viral in the acute, and in the chronic it can be linked to diseases like cancer or tuberculosis, but the main cause is unknown. Cardiac tamponade can also occur as a result of trauma or following cardiac surgeries. Otherwise, those are some of the conditions that affects the pericardium. So tomorrow I'm going to talk about the myocardium and the endocardium and the diseases that are associated to the two main layers of the heart. So it's still the structure of the heart. There are so many things to talk about the structure of the heart. So due to public demand, people demanded that I should talk about a certain part of the heart. Then I talk about the conditions that occur on that part. So today I talked about the pericardium and the conditions that are associated with the pericardium. Tune in my next video where I'm going to talk about the myocardium and the endocardium, and I'll talk about the conditions that are associated with them. Then we go through the heart. I'm going to talk about all the parts of the heart and the diseases that occur on them. Thank you very much for tuning into my YouTube channel. Tomorrow I will talk about the myocardium and the endocardium and the diseases associated. Thank you. Do not forget to subscribe to my channel and like and share with others. Thank you.